Thank you very much, Madam Chair. Ms. Maxwell, let me start with you, if I may. You had some really valuable, I think, and very helpful information on the damage done in terms of family separation to young children. We obviously have a larger population that is unaccompanied, and so they don't go through that. But if you could distinguish, and the last testimony actually probably did a pretty good job of this, but that second population, which we are dealing with in very large numbers, what are the differences that you see between, obviously, family separation, which I think we all agree was a bad mistake, and obviously the more normal situation that we're now dealing with of unaccompanied children? Are they traumatized to the same extent, or?
Yes, thank you for that question. Yeah, our report largely deals with the entire population of children that the OR facilities have to provide mental health care. Most of the challenges that we heard about were, in fact, systemic challenges that affected all the children in care. And we heard again and again that all the children in care suffered, severe trauma in home country during the journey, and that some children experienced the additional trauma of unexpectedly being separated from their parents. But as we move forward with our recommendations on practical steps that OR can take to address these systemic challenges, we have designed them such that they would help improve the mental health care for all the children that OR facilities are responsible for caring for.
Thank you. Director Hayes, could you give me some idea of the steps that you've taken to respond to some of the suggestions and recommendations that the IG has placed in front of you?
Yes, sir, Congressman, happy to. So again, we are working on a number of things in response to the OIG's report. We already are working on developing an intern program with colleges and universities in order to place interested students in ORR programs with hopes that they will one day come and join us as professionals postgraduate. Additional funding for continuing education to licensed clinicians as a retention strategy is also something that we're undertaking. We're working to expand our presence at job fairs across the nation in order to find needed clinicians and case managers to work in our facilities, although I will note that a number of those job fairs have been protested and some of the staff potential staff verbally threatened, and so that is not helpful. We've also partnered with the National Child Traumatic Stress Network, the NCTSN, to develop a 4-part webinar series, as I referenced in my testimony, on trauma in the UAC. And in April of 2019, we also hired a board-certified adolescent and adult psychiatrist that is employed inside of the Division of Health of Unaccompanied Children at ORR.
Well, I commend you for those steps. I'm going to go back very quickly to Ms. Maxwell. Do you have a mechanism to follow up? I think there's a good faith effort going on at ORR to try and respond, but it's important, obviously, that we have, as you provided us, sort of an outside view to make sure that process continues.
Absolutely. Thank you. We are happy to see the steps that OR has already committed to, some of which they've already undertaken. So that's a good start. But yes, our process is to always follow up the recommendations and be in conversation with the department to ensure that all of the commitments that they made are fulfilled and are fulfilled to sort of the spirit of the recommendation as well. So we will continue to work with the department to make sure.
And I hope you stay, and as I know you will, stay in touch with this committee, because obviously at the end of the day, we've got a resource requirement here. Let me go back to you, if I may, Director Hayes. It's got to be extraordinarily difficult to get the personnel you need. We know that, as I mentioned earlier, just in terms of mental health for the entire population. In this case, you need bilingual professionals, I would suspect, in many cases. There can't be a ton of those, particularly in a lot of the areas that you have your shelters. So, I mean, number one, what are you doing? What level of success are you having?
So thank you, Congressman. Yes, to your point, the Flores Settlement Agreement does require the majority of our shelters to be in the area where the majority of the children are apprehended: Southeast Texas, the Northeast Corridor, Southern Florida, and Southern California. And so, there is a challenge in those areas to identify and retain, some of the licensed clinicians that we need. We are looking to expand outside of some of those areas. We worked very closely with keeping the committee staff informed on our efforts to look into larger metropolitan areas where we can have some of these smaller and medium-sized shelters. and hopefully tap into a fresh pool of clinician staff, although we are seeing some resistance to that, even right here in our own backyard in D.C. and Northern Virginia. Again, at the expressed desire of Congress to open up more smaller and medium-sized shelters that are licensed, we're seeking to do that and not really receiving a lot of support, actually opposition by both D.C. and Northern Virginia. So we'll continue to look in other areas and expand outside of that where we can pull, from the local community the needed licensed clinicians and case managers and youth care workers and other support staff that we need.
Thank you very much.